Good afternoon, everyone, and welcome to today's Upfront broadcast. My name is Jeff Freitas, and I am the president of CFT. I'll be joined in a few minutes by two great CFT leaders that will share about what's going on in their county. But first, I want to share a few updates. CFT recently conducted an internal poll of our members focused on vaccines and in-person education. You, the members, indicated that you are ready to return to in-person instruction so long as you are offered the vaccine and safety measures were in place. The results of the poll, which were conducted between January 25th and February 5th, come as President Joe Biden and the CDC both urge states to prioritize vaccinating teachers and school workers. The data confirms the CFT's position that was taken on the vaccine. CFT supports the vaccine as a major fight against the COVID-19 virus, and our members have shown us that you understand the safety and the reason to get vaccinated, with 87% of you stating that you will get the vaccine when it is offered to you. But the CFT members also place a high importance on receiving the vaccination as part of the safety measures to return to school for in-person instruction, with 90% saying vaccines should be available to school workers for in-person education. You also strongly believe that other safety measures must be included, like adequate PPE, reasonable accommodations for staff and students that need them, good ventilation in our schools, and social distancing on campus and in the classrooms, as well as the other items that were listed in the CDC and the state guidance. This member data is timely, as earlier this week, Blue Shield has begun the process to lead the state's vaccination program and announced the goal of being able to administer 3 million shots a week by March 1st in California alone. We absolutely can vaccinate every teacher and school worker in the state in the coming weeks. Part of revised vaccine distribution plan in California proves that we can get this done. As we have been pushing for essential workers and especially school workers to get vaccinated as quickly as possible, we are seeing that more and more counties are vaccinating school workers. For example, Santa Cruz County vaccinated over 600 school employees in the last week, and we'll get to more details on that, and are making vaccinations a part of the phased-in reopening approach for which CFT has long advocated. In Berkeley, teachers reached a deal to phase in the reopening of schools to hybrid teaching and in-person instruction by including educator vaccinations as part of their agreement. Vaccinations for teachers and school staff will begin as early as next week, February 22nd, just to time date that, and continue through the spring as the schools phase in-person education for students, beginning with the lower grades first. And there are several other examples where there have been agreements reached, like in San Francisco with UASF and other labor unions, and other places where educators and classified professionals are already getting vaccinations, like our members in Evergreen Local in Tehama County or Sonora High School Local in Tuolumne County. Governor Newsom and the state legislature are still hammering out a deal for reopening. But in the meantime, we shouldn't wait to vaccinate our school workers, all school workers. The progress on vaccinations over the last few weeks is very promising to getting to safe, in-person education. And we will continue to advocate state and local officials to prioritize vaccinating educators and classified professionals to pave the way for the safest phased-in reopening of our schools for in-person instruction. Talks are ongoing at the state level with the legislature and the governor, and CFT will continue its advocacy. We will continue to update you both via this broadcast and through our regular weekly email called the Inside CFT. And speaking of educators and vaccines and rolling this out, I would like to welcome today's guests. I'm joined by two local presidents, Casey Carlson of the Greater Santa Cruz Federation of Teachers and Nelly Vaquera-Boggs of the Pajaro Valley Federation of Teachers. Welcome, Casey and Nelly.
Hello. Thanks for having us here.
Thanks for joining us today. First, we'll go and have you introduce yourself. First, Nelly, if you'd like to introduce yourself and your local and who you represent.
Yeah, I'm Nelly Vaquera-Boggs. I'm the president for the Pajaro Valley Federation of Teachers, Local 1936. We represent preschool teachers, K-12, and adult ed. The adult ed program in our district encompasses the entire Santa Cruz County.
Wow, that's it keeps you busy, I guess. And Casey Carlson, can you introduce yourself?
Hi, I'm Casey Carlson. I'm the president of the Greater Santa Cruz Federation of Teachers 2030, and we're in the city of Santa Cruz and some of the county areas. So we have about 390 members, and we represent TK through 12th grade.
And you're both in Santa Cruz County, which brings up the topic about what's been going on. So Casey, can you start by describing the COVID situation within the county of Santa Cruz?
Sure. Right now, cases are dropping, and we're likely to return to red within a week or two. When we were doing our planning in the last few months, we were in purple. So it's an ever-changing situation, but it looks like we'll be in red fairly soon. What Nelly can tell you more about is that the case distribution in Santa Cruz County is quite uneven. Based on income disparity. And so she's going to tell you about more cases in her district than there is here in Santa Cruz, in the city of Santa Cruz. So I'll let her talk about that.
Thank you, Casey. Nelly, do you want to talk about
that? Casey's correct. It's there is that correlation of between income and COVID rates, and if you looked at the county of Santa Cruz. We're located in the Watsonville and Aptos area. So even within our school district, we do have a range of income statuses. In the city of Watsonville in particular, there is a higher number of COVID rates, and that bears actually the brunt of a majority of the COVID rates in Santa Cruz County. I believe there's about maybe 55% of the COVID cases are in our school service area. So that's when we look at the county average, we then try to focus solely on our school service area because many of our families who are the essential workers in the area are at a higher risk as we move our students back into the classroom.
And thank you for that information. It's very interesting. Just like the state, the state really only tracks it by county and not zip code, as they like to say. And it's interesting how the zip codes, even within a county, are very different and so important to prevent the spread to get the vaccine. So the county in Santa Cruz has developed a plan. I was wondering, Casey, maybe you could start with how did the county come about to prioritize teachers and education workers? Maybe you can describe
to be clear,
what I mean by county.
Yeah. It's our county office of ed that's been helping us. The Santa Cruz County Public Health Authority has not been in support of vaccinating educators. They want to prioritize 65 and above. And in spite of the lobbying by our members and our superintendents and the county superintendent, they've been resistant to including us at all in the vaccines, and they've actively opposed the efforts that are going forward now to get the vaccine to educators. So when we say county, we mean our county office of education, which has brought together the superintendents from all of our school districts. I think that it started as a grassroots efforts from the unions. And we have, so the two largest districts, Pajaro and Santa Cruz, were CFT, and then we have CTA locals, but we've all been in communication. We all wrote a letter together to Gail Newell. And so all of the union leaders have from the grassroots pressured our superintendents and said, we're not going back without the vaccine. And our superintendent said, okay, we agree. And then they pressured our county office of ed. And our county office of ed superintendent, Faris Sabah, has just done a remarkable, stellar job of negotiating with one of our healthcare providers, Dignity Health, to get the vaccine for all. When I say educators, I mean all the school staff and all the teachers, classified as well as certificated.
Now, Casey, I know you got your shot. I saw a picture. It's amazing. You're there in the schools. Nelly, has some of your members gotten shots yet?
Yes, they have. They began a couple weeks ago, and well, our first group of members who received their first dose was in January, and that were our school nurses, because we had originally planned. Our district was going to have a site, one of our sites, be the site where our members would all go to, or all employees in the district would go to receive their vaccine. And the district had worked with Cabrillo College to help with staffing the site so that this Cabrillo College students in the nursing program would be able to help administer vaccines. And so that was all before the distribution guidelines changed. And at that point, it was very a nice save by Faris Sabah stepping in to negotiate with Dignity, and a very gracious, I think, heroic thing that Dignity has done in for our educators, in allowing educators and support staff to be vaccinated. And PBFT, we did advocate for our brothers and sisters in CSEA to be vaccinated before us, because they have been on site since we all went off site. So we wanted to make sure that the people who were taking care of maintaining our sites, working in our offices, working with students who are attending what we call safe learning zones, so that they can have access to internet, to have them vaccinated. And so that all fits in with our prioritization process. But yes, that it is, we're very, very grateful to Faris Sabah and to Dignity Health for helping make this possible.
That's amazing. I'm so happy that that's happening in Santa Cruz County, even with some of the obstacles. So I'm going to ask both of you, but first, Casey, let me ask you, what are you hearing from the members? As they are starting to get the vaccine and preparing to return to school sites and to be in-person education, what are you hearing from them?
Let me back up just a little bit, because we started to talk about priorities, because that's crucial to how we return. So both our districts, and I believe all the districts have done this, we started with our TK and kinders. And then, moved into the elementary 1 through 5, and then the middle school, and this weekend, the high school teachers. And that's key to how we're doing this phased reopening. So we had an agreement that our faculty and staff have to have both vaccines, and then we agreed to a period of one week. And I know that some districts are going back simultaneously, some are going back a couple days after, some. I know that we had wanted a 2-week period of time, but as in all negotiations, there was that compromise. So I would say that as people were thrilled and excited and so grateful to have the vaccine, and they still are, and it's going really well. I mean, we haven't heard about, other than some sore arms, we haven't really heard about any bad side effects. And so now what we're doing is looking at the next steps. And so there was concern, for instance, from our members about how do we get ready to make the transition from distance learning to hybrid. And so we have an agreement with the district that we're going to have 1 full week where teachers cannot be, they won't be teaching through Zoom except for that like mandatory short meeting in the morning. So they'll do like a half an hour meeting in the morning, and then they'll have the rest of the days asynchronous for a full week before we make the transition, so that that will help them, to get ready to get together with their colleagues. And there'll be some professional development offered during that time. So that was a big concern. The other concern I would say that's most prevalent is a concern about enforcement of the COVID protocols, especially with our secondary students. I think with the elementary, it's more a question of like they'll forget and they'll have to be reminded. But there's a lot of fear at secondary of kids being defiant. We've had anti-masking, in Santa Cruz, as I think people have all over the state. And our district has added the COVID compliant behaviors to our behavior matrix. And if students refuse or families refuse to comply, then those students will need to go back onto distance learning. They won't be allowed on campus if they won't follow the social distancing and the masking guidelines. So I would say those were the two big concerns as we get ready to go back, was having the time to get ready and then making sure that there was compliance. The other thing that we said had to be completed before we return is the ventilation assessment. And I've gotten a preliminary report. It's very thorough, and the final report's supposed to come out I think later this week. And I know that our district has spent $750,000 already on upgrades to our ventilation system. And it'll be we insisted that the report be distributed to the public and be in writing, and so that any parent, student, faculty member, staff could look at the report and say, oh, I'm in this room at this school site. This is the ventilation situation there. And so we did that in partnership with our district to get that information out. And I think that that's going to be a good comfort for people coming in to see, that the ventilation is adequate.
Yeah, those mitigating strategies are so important, even with the vaccines of school workers. Thank you, Nelly. What are you hearing from your members?
A lot of the same, a lot of gratitude for finally being able to get this vaccine. Back in August, we negotiated for our district to ensure that the HVAC systems were adequate, and so they utilized the CARES Act money in the fall to overhaul all the sites. And so all of our school sites have been upgraded to a MERV 13. And then if for some reason they were not able to adapt to a MERV 13, every single space will also have a HEPA air purifier. So there was, I think, just under $4 million went into upgrading HVAC throughout our district in the fall. And we also, along with that, in our MOU from this last August, we had also negotiated that surveillance testing be at the sites during the school day. And so, they've been rolling it out. Right now, it's only at the district office, but now as they're going to start opening up, as they phase in sites, they are going to expand on that. So there will be surveillance testing at sites. We have PPE. So there are all the safety mitigating factors that we have negotiated, they've complied with. And so it's with the vaccine, our members are feeling, there's still a cause for concern. We're still going to wear our masks, but they're ready to go back into the classroom. They're willing to go back into the classroom.
Right.
It's
it'll be refreshing to be able to see everybody in a safe environment. And it sounds like you both are doing a great job making sure that there is that safe environment, not only for the school workers, but also for the students. I mean, this is the students aren't going to be getting the vaccine, and we need to make sure that their families are also safe. And so we need to continue these mitigating strategies for their families as well. I want to thank you both. Is there anything else to add that you want to add? Nelly, let me start with you first. Is there anything else to add that you want to tell everybody?
Oh, well, in regards to vaccines, I really do hope that you opt to receive the vaccine. If if there is a medical reason why, for not being able to, we understand. But it is it's for the good of our public health. I see it as that. Mhm.
Absolutely.
And I'd like to do a shout out to ABC for their training work over the years in our partnerships, because with our PAL, our partnership labor agreement, this really tough time has been so much easier being able to work with our district leadership because we already have that structure going. In a time of crisis, it really pays off. And I know not everyone can do that depending on who your superintendent is or whatnot, but if you can, having that working relationship is really beneficial.
Well, that's great to hear, and that's us working together, the entire school community working together to do what's right for the school community. I want to thank you both for joining us today and sharing the work that you're doing in Santa Cruz County and in your school districts, and making sure that not only the school workers are safe, but also the students are safe. So thank you for joining today.
Thank you.
Thank you, Jeff. Thanks. Bye, Nelly.
Bye.
With that, I want to wrap up today's CFT broadcast, upfront broadcast. We will be providing more information as the legislature and the governor are working out the reopening plans at the state level. And when I say reopening plans, I'm talking about in-person education, because as you just heard, the schools are open. We are providing education through remote learning the best we can to our students throughout the state of California. See you next week. Again, thank you for joining us. Stay safe and take care. Have a good weekend.